The shoulder is a complex joint and may have various causes to be painful and limited in motion. Many muscles, tendons, ligaments, capsules or nerves can be involved in the shoulder and arm pain. That's why sometimes it may be a little bit difficult to do precise differential diagnosis. The great advantage of cupping treatment is that by applying general protocol, you can cover a large radius of shoulder disorders without the need for precise diagnosis and still be very effective and get tremendous results. For general shoulder treatment, we should cover a relatively big area, starting on the upper back, including the supraspinatus and infraspinatus, then teres muscles, deltoid, and finally the pecs in front. If the arm is involved in pain, then I will address also the biceps, triceps, and their underlying muscles. Make sure to check the scalenus muscle because it can refer pain to the shoulder and arm too. Start with cupping massage of the supraspinatus, infraspinatus, and teres muscles in prone position with patient's arm laid out of the bed. You can use 2 cups simultaneously to save your time. Do it slowly in few directions. After that, change the patient's position to lateral recumbent and proceed with cupping massage of the deltoid and arm. If the area is too sensitive, choose softer cup. Continue in sitting position. Ask the patient to move the shoulder in various directions and during the movement ask him to point on the spots that are painful during the motion.
Here and here.
And mark them for cupping. After that, find the tender and tight spots by your palpation on the relevant muscles and mark them too. The supraspinatus, infraspinatus, teres muscles, deltoids, and pecs. Then cup all the marked spots with plastic cup statically. Some of the marks may be close to each other, so you can cover them under the same cup. After all cups are placed, make sure that the patient can tolerate it, and if anything feels too intense for him, release it and reapply with less suction. Leave the cups on for 3 to 5 minutes and release. Alternatively, you can use dynamic cupping instead of static cups. It is more effective if the patient has limited motion in shoulder joint. Place silicone cups on the same painful spots of the shoulder muscles. And guide the patient to move the shoulder in different directions slowly. Start with small movements and gradually increase the range of motion. Do 5 to 6 motions in each direction. If the patient can't move his shoulder actively, help him by supporting his forearm and elbow. If they cannot move the joint at all, then move the cups passively and slightly without actually moving them from their place. Do it for 3 to 5 minutes and release the cups. Finally, cover the entire shoulder arm area with silicone cups. Starting with deltoid. Pectoral muscle in front and rotator cuff muscles on back. And stretch the shoulder in different directions. First take the arm back and stay there for approximately half minute. Then stretch to the opposite direction forward. And raise it up to 90 degrees with your support. Then release the cups. And reapply them on the uncovered areas. And repeat the 3 stretches again. And release the cups. If you would like to master both dry and wet cupping and learn how to treat real conditions like back pain, headaches, shoulder disorders and more with confidence, visit cupping-therapy.net. Inside the complete Master's Edition Cupping Therapy course, I will guide you step by step through every technique so you can achieve safe, effective and professional results with your clients.